So today's case is eye rejuvenation. So this patient here in the preoperative view here, you can see has a combination of things happening to the eyes. And one of the most important elements of doing a successful eye rejuvenation is the proper assessment and diagnosis. So let's go through this and figure out what's going on. So her main complaint is that she looks tired, she looks drawn, she doesn't look as fresh as she normally does. People comment that she doesn't sleep well, or that, why does she appear so tired? So what you can see is causing that is the darkness and puffiness under her eyes. That's sort of a classic stereotypical look of somebody who has not slept well or that is fatigued. There is the darkness and puffiness. In this case, it's being caused by excess fat and skin. That's a genetic component that is causing the eyelid to pouch forward. And then there is a hollowness along the bony aspect of the rim, and you can feel that when you put your fingers on the depression. There's literally just bone right there, and normally there should be a subtle fat pad that separates the skin and creates a buffer between the skin and the bone. And when that goes away, you start to see a trough, and we call it a tear trough or infraorbital hollowing. And when you look at the lower lid, another component is the eyelid cheek junction increases. That's the distance between the eyelid and the cheek. It's getting longer with age, and that's another one of those telltale signs of somebody who is looking tired and aged and drawn. The upper lids in this particular case, you can see is showing signs of excess skin, and that excess skin is causing a heaviness along the upper eyelid and causing some fullness along the edges of the eyelid and corners of the brow. And in this particular approach that I performed here in this after photo, what I did was I addressed the hollowing with a fat transfer. I used lower blepharoplasty to remove the puffiness and puffiness and bags under her eyes, and then I did an upper blepharoplasty to remove the skin. The incision on the upper eyelid is placed in the natural crease, that's why you can't see it. The lower eyelid incision is done both internally inside the eyelid as well as skin removal on the external aspect. And the fat transfer that's used to fill the lower eyelid and create that smooth transition between the eyelid and the cheek is fat that's taken from the stomach or outer thighs and used to inject into this area as a graft. So you get a permanent volume in that area. But if you pay special attention to the distance between the eyelid and the cheek, you notice that distance, the eyelid cheek junction, in the after photo has shortened significantly. We have a much shorter distance between the start of the eyelid and the beginning of the cheek. All of this in combination creates a very rested, very rejuvenated, very natural looking outcome, which is obviously so important to a happy and satisfactory end result. This is a combination that I use very commonly. I do these pieces together. In most cases where we see a combination of effects happening to the periorbital region. If you have any questions at all, please comment below. You can always email our practice website. Also, don't forget to subscribe to this channel. We're going to have more case studies, more before and afters as the weeks and months go forward. Thanks so much.